And today I'm going to show you how to make your very own care plan. So I plugged in our information up here at the top, and we're going to continue on with this diagnosis of pneumonia. And okay, what's a definition? So let's say pneumonia is an excess of, of fluid in the lungs resulting from an inflammatory process. Okay, so in yellow, this doesn't come on the care plan, but I just set this up so we could pie our way through this. So we're going to start with assessment and diagnosis. And when in practice, we're going to assess before we make the diagnosis, but on our care plan, the diagnosis is going to come first. So continuing on with our pneumonia diagnosis from the last show, we're going to say impaired gas exchange related to, and you can use the little RT there. And last time we said alveolar capillary membrane changes. And you can write out secondary, or I just make out one of these little things with the degrees there, secondary to pneumonia. And now that we have our diagnosis, we're going to write in our assessment information. So here is my three-part nursing diagnosis, because I've got my related to, my secondary. Now we need to know what assessment data led us to make this diagnosis. So we're going to put AEB as evidenced by, and you got to have some subjective and objective information. And if you recall, subjective information is stuff only the patient can tell you. Symptoms that the patient is experiencing that maybe you can't see. So maybe your patient says, well, I can't breathe. Okay, well, that's what the patient said, and that's subjective. Maybe your patient wakes up and says, my lungs are rattling and I'm coughing up a lot of phlegm. Okay, fair enough. Now we've assessed our patient, and we're going to write in the objective information that we've seen. So the objective information is stuff the nurse is going to observe firsthand. So I'm looking at my patient, I'm doing my head to toe assessment, and my patient has cyanosis. So her lips are blue, and maybe her face is kind of pale, turning colors. I saw that, so I'm going to say that. When I was taking her vital signs, I noticed that her respiration rate was fast. So, her respiration rate varied from time to time, but it was greater than 30, which is quite a lot. So she's having to breathe really hard. Also, her oxygen saturation is low. And again, this can fluctuate, but when I saw this patient, I noticed that it was kind of staying below, 90%. I also noticed when I looked at her chart that she had abnormal ABGs. And hopefully you guys have heard about these ABGs. They're arterial blood gases, and they're a lab that you'll be becoming familiar with if you haven't already. But let's make this a little more specific. Let's say her ABG, her CO2 was 50, and Maybe her pH was acidic, so let's say 7.30. Just to roll with me here. Maybe she's sweating. She doesn't have very good oxygen perfusion, and she's getting tired of working so hard to breathe, and she's getting all diaphoretic on us. And sometimes when people aren't getting enough oxygen, they have a decreased mentation. So we notice that about our patient too. So there's some things that I saw and the patient told me that led me to believe that she really does have impaired gas exchange. Okay, so now that we have our assessment done and we've made our diagnosis off our assessment, we want to set some goals for our patient, because we're not just going to make a diagnosis and call it a day. We want to help this patient get better. So we need to make some goals so that we can achieve those and get this patient on her way. So we want to make some short-term goals and we want to make some long-term goals. So let's start off by our short-term goals, and we'll just label them as such. So first of all, the most important thing is that I want this patient to maintain an oxygen saturation, maybe let's say above 95% throughout my care with her today, or throughout my shift. So, and now all of these goals and these outcomes, they need to be specific and they need to be measurable. So I can look at my O2 sats throughout the day, or on the telemonitor, or wherever I have this patient, I'm looking at them, and I can measure that by saying, well, is this greater than or less than 95%? So it's specific and it's measurable. So, okay, well, that's great. I got this patient that I want to keep above 95%, so how am I going to do that? Well, that's when we're going to put in our interventions. So what I do is I just kind of number these 1, and here's my intervention for number 1. So student nurse will administer oxygen as prescribed, because we all know that oxygen needs to be prescribed by the physician or the provider. So student nurse will administer oxygen as prescribed by the provider for O2 sats, let's say lower than 90%, because we don't want them to get too low, and we want them to keep them at a good level there. Cool. So that's great. I've got my goal, I've got my intervention, but how do we know that that intervention is going to work? Well, I just happened to look up in my Iggy book, and I found that oxygen therapy is prescribed for relief of hypoxia and adequate oxygenation. Okay, and I didn't just pull this out of thin air. I found it in my Iggy book, 2011 edition, on page 628. Oh, I forgot an X. Okay, so there is my whole shebang right there. I've got my assessment, my diagnosis, my planning, my intervention, and the rationale for that intervention, and then later we're gonna do the evaluation. All right, so we're not gonna just save the day with one outcome and one intervention here. So let's plug in some more. We got some more short-term goals we need to accomplish here. So I say I want my patient or a patient will maintain cognitive orientation throughout shift with student nurse. Because down here in our objective information, we noticed that our patient has this decreased mentation from the lack of oxygen. Well, we're going to go over to our interventions, and I forgot to say this earlier that interventions need to be specific as well, and we need to say the who, what, where, when, why, how specificity of these interventions. So for number 2, we're going to maintain cognition by giving her this oxygen, of course, so I could even say 1 and 2. But we also are going to say student nurse will position patient in semi-Fowler's while awake. Okay, well, we all know that if you're sitting upright instead of lying down, that you're going to have better oxygenation, but we need some evidence-based rationale here. So I happened to look up in my Ackley and Ladwig book, and I got a good rationale here, and it says sitting upright results in an increased tidal volume and proper ventilation, and that's all it said. So, and then I'm going to put Ackley and Ladwig, 2011 edition, page 403. Cool. Also, we kind of want to say here, well, how are we going to make sure that this patient's maintaining cognitive orientation? Well, we're going to monitor this patient. So we'll say student nurse will continuously monitor patient's behavior and any change in mentation throughout shift, or let's say every 2 hours when we're doing our vital signs or assessment or something like that. And I like these to line up here. So I actually also happened to find a rationale for this in my Ackley and Ladwig book, and it says change in behavior and mentation is an early sign of impaired gas exchange. So that's why it's so important to be checking that. Ackley, Ladwig, 2011 page, I forget, we'll say 403, 402. So, you kind of get the idea here where you gotta put in your outcome, back it up with the intervention, back that up with a rationale. So one of the most important elements to a care plan is education. So I'm going to put in a short-term goal of mine to be an education point. So, patient will verbalize understanding of importance of coughing / deep breathing / use of incentive spirometer, and it's got to be specific. When do we want this to be done by? Let's say before 1500 today, or you can put in the specific date. So how are we going to make sure that goal is met? Student nurse will educate patient on importance of coughing, deep breathing, use of IS before 1400, because we got our 1500 goal over here. We'll give it some time to sink in. All right, and our rationale, another Ackley and Ladwig one, says coughing, deep breathing, and use of inspiratory spirometer clears lungs and prevents or reverses atelectasis. That's a hard word to spell. And if anybody is really interested in looking it up, they can find it in Ackley and Ladwig, 2011 edition, page, I forget, 405. So there is our short-term goals there. Okay, so now let's do a long-term goal just for the sake of explaining it here. So a long-term goal of mine might be patient will display signs and symptoms. You can use these abbreviations of here of adequate oxygenation. And again, we need to be specific, so we can't just say adequate oxygenation. Well, what does that mean? Let's say a respiratory rate no more than 16. Normal skin color, not cyanosis. An O2 sat greater than 95. And let's say a regular respiratory rate rhythm depth. And we got to put in our long-term time frames. So let's say patient will display these every day until discharge. And then you're going to write in the same thing here for your intervention, and then make sure that you give a rationale over here. Okay, so the fun part about making a care plan is taking everything that you've put in here and evaluating it and asking, were these outcomes met? Were the interventions that I provided for the goals, were they effective? And that's where these come in over here. So our first goal was that the patient would maintain this oxygen saturation and that we would give this oxygen therapy to make sure that this outcome was met. So it's the end of my shift, and indeed my patient did keep a good O2 sat above 95%. So over here in my evaluation, I'm going to say my outcome was met. Outcome met. And how was it met? Well, student nurse gave the oxygen for O2 sats that were lower than 90%. And patient maintained O2 greater, we don't need that, greater than 95%. Great, our outcome was met. What about our next one? Did our patient maintain cognitive orientation throughout shift? Why, yes, she did. Outcome met. Patient maintained cognitive orientation throughout shift. Because the student nurse continuously monitored patient fomentation changes and gave adequate O2, and kept in semi-Fowler's position for better ventilation and perfusion. Cool. What about my third goal? Well, I'm sorry to say that this outcome was not met because even though I educated my patient on the importance of these things, she just did not get it. She couldn't comprehend this. So I'm going to keep working on her, and I'm going to say the outcome was not met, and then I'm going to revise my plan. So outcome not met because, well, student nurse educated patient on importance of coughing, abbreviate deep breathing, and IS, but patient was not ready to participate in learning because due to fatigue. We'll say that. We'll try again during tomorrow's shift and meet goal by 1500. And so on and so forth. So, and that's how you would evaluate yourself. You would say whether the goal was met and what you did or did not do, what you did to make sure that the goal was met, or if it wasn't met, what happened and how you're going to revise your plan. So hopefully this video has helped you understand the care plan writing process a little bit better. And I promise it does get easier, and writing these care plans will help you. Every time you write them, you'll understand the nursing process a little bit more. So good luck to you all in writing care plans and your nursing practice.